Okay, I think we are ready to get started. So thank you all for joining us tonight for this info session, facts about the vaccine for Philadelphians under 18. So a lot has happened since the last info session that we hosted. Right now, more than 50% of Philadelphians are fully vaccinated, and case counts are the lowest that they've been in a long time. So this is exciting news. And now that the vaccine has been approved for use among those over 12 years old, we are really excited to talk with you tonight about the vaccine as it relates to this age group. So before we get started, I just want to go over how to use the interpretation services and ask questions. So you'll see our ASL interpreter, Jennifer McGowan, is pinned to the top of the screen. And then if you click the globe icon on the bottom of the screen, you'll be able to see the different channels that exist. So the 5 different languages that you can tune into in order to hear the session in those languages. And I just want to thank all of our interpreters for being here tonight and helping out. We're really appreciative of their support. And then I also just want to encourage you all to ask questions throughout the night using the Q&A function. So you can just type them into the Q&A, and then we'll be answering them at the end of the session, and any questions that we can answer through the chat, we'll also try to do it that way. But please, we really encourage you to ask any questions that you have. So then I'll just jump in with introductions of who's here tonight. From the health department, we have the outreach team here. My name is Emily Klein. I'm the partnerships coordinator. Terry Clark and Rachel Giatris are also on the outreach team. And then we have Betty Mulageta and Niall Fawcett, who are outreach specialists. And then our speaker tonight is Dr. Susan Coffin. She's an attending physician for the Division of Infectious Diseases at the Children's Hospital of Philadelphia. She's actively engaged in the clinical care of children with infections and in research on the transmission of infectious diseases. Dr. Coffin has also worn several hats at the health department. She was the medical director of the Healthcare Associated Infections Program, and she's been a really great partner throughout the pandemic response. So we're excited to have her here tonight. So I'm going to turn it over to Dr. Coffin now to share information with you all about the vaccine to help you make a decision about vaccinating your children.
Thanks so much, Emily. Hello to everyone here, and I really hope you find this the session useful. I'm going to share a few bits of information, but what I really hope for most is that questions that you have or concerns that I haven't spoken about or haven't been clear about, please ask questions. I really think this is a wonderful time for us to learn from each other, and for all of us at the health department, at CHOP, and elsewhere in the city to have an opportunity to make our vaccination programs work best for you and for your families. Next slide. So, as Emily said, there's a lot of good news about COVID in our city. Rates are low, lower than we've seen them in so many months, and many people have been vaccinated. But the story around children in COVID is changing, and not completely in the best of ways. So right now, children represent somewhere around a quarter to a third of all the new cases that we're identifying in Philadelphia. And that's a big change. At the start of the pandemic and through the summer and even early fall, children were a very small proportion of all the cases. Now they are at really quite high risk. While we know that many children who do get COVID infections are lucky and don't have very serious symptoms, a lot of them are completely asymptomatic. But as a pediatrician, I get to see the other part of that story. I get to see the many, many children in our city who get sick. We've had hundreds of children hospitalized at CHOP over the course of the pandemic. And St. Christopher's has also had a lot of children hospitalized. So many of our children in this city have gotten sick, sick enough to require hospital stays, some of them sick enough to require very long hospital stays. Nationwide, the story is concerning too. Several hundred children have died of COVID. That's more children that die each year of a disease, influenza, that we routinely use a vaccine to prevent those pediatric deaths. And so what I'm going to share with you tonight is my perspective that children really do need COVID vaccines. They need them to keep themselves safe and healthy. They need them to keep you safe and healthy. And they need them to get our community back on track and then back in school or their usual activities. Next slide. So this is what we want to avoid. We want to avoid the chain of transmission. And it all starts with an exposure. Someone, somehow, probably not the Queen of England here, but somehow gets respiratory secretions out and about into their world. Could be because they scratched their nose and didn't wash their hands. Could be because they sneezed and didn't cover their cough. But that puts any of us at risk for the virus entering. And once it enters our system, we're at risk of the virus actually going deep into our systems, attaching to a cell, multiplying, and then going from just being an exposure to an active infection, meaning that that virus is living and growing inside us. Once that happens, all bets are off. Some people get lucky. They have a mild infection. They do quite well. Other people feel lousy for a couple of days, might have to sit in bed and, just watch TV or read a book rather than go about their usual activities, but then get back on track. As we know, though, thousands of people in Philadelphia have required hospitalization and hundreds have died. So the whole progression from exposure through to actual infection and disease is potentially a really serious path and one that we want to avoid. Next slide. So what I thought I'd start tonight by doing is just explaining to you what I see as some really important facts about vaccines in general, and particularly about the COVID vaccine. So we're going to be focusing on vaccines for children. And right now, there is one vaccine which we can give in the US to people between the ages of 12 and 18 years of age. And that's the Pfizer vaccine. That's a vaccine that's made of a substance called mRNA. The mRNA stands for messenger, and then ribonucleic acid. And that's a bit of a mouthful. That really is a pretty scientific term. But what mRNA does is it basically is a cookbook. It's a recipe. It tells your body how to make a protein, and that protein tells your body how to make an immune response. And so that's what the mRNA is doing. Let's look at how this compares, though, to a traditional vaccine. You can see over on the left-hand side of the screen a little cartoon of what a traditional vaccine looks like. This is a vaccine for a virus, and you can see that it contains all of the virus. It contains the outside core, that purple circle. It contains little spikes of protein coming out of the outside of it. And on the inside, you can see that it contains the RNA of the virus. So when you get a traditional vaccine, many contain all of these things. They contain the proteins, the whole virus, and the mRNA. Those are vaccines that we give that are called killed or weakened virus vaccines. So how does this compare to an mRNA vaccine? Well, in an mRNA vaccine, everything is stripped away from that virus. The only bit of that virus that is injected is that little shred of mRNA, that little recipe. The process of making the vaccine also includes the addition of a small amount of lipids. Those are fats. They actually provide a little cushion to protect the mRNA. And then also some sugars and saline or salt water. The low concentration of sugars and the natural concentration of salt water is the same that is in your cells every day. And so it's really really the only thing of note in this vaccine is that RNA particle. There's no preservatives, there's no latex, there's no egg products. So it's a quite pure substance that is in this vaccine. Next slide. So once it gets into a body, what happens? Well, basically, like I shared with you, I think of this mRNA as being a little recipe book, and it basically is providing your body an instruction, a little recipe on how to make protective antibodies, those protective proteins that are going to flow around in your bloodstream and keep you protected if you should ever encounter COVID in your community. When it does that, though, it does it by staying far, far away from your own body's DNA, a different type of nucleic acid. The viral RNA that comes with the vaccine stays far away from the cell's nucleus where your DNA lives. And so sometimes people ask the question, could it possibly result in mixing of my DNA with the viral vaccine? And the answer is no. These two places stay far, far away. The other thing that people sometimes ask is what happens once it gets in there? Am I going to be living with viral DNA or RNA in my body forevermore? And again, the answer there is no. Your body expels it. It gets flushed right out of your body in somewhere between 7 to 10 days. Next slide. So let's talk a little bit more specifically about the vaccine that's available for teenagers. This is the vaccine that was licensed for use just last month, or I guess now 2 months ago in April, and it's licensed for all people who are 12 and older. To get immunity from this vaccine, you do need to get 2 shots, and it's recommended that you get those shots 3 weeks apart, 21 days. Once you get the shots, you're not immediately protected. It takes about 2 weeks after the second shot for your body to have generated that full maximum protection that is going to give you the ability to go out, partake in more activities than you have been doing before, if that's what you choose. Another important piece of information to know, particularly for parents with kids who need some of their shots before they go back to school in the fall, is that this vaccine can now be safely given with other childhood vaccines. So it's not as though you have to make multiple visits to your child's pediatrician in order to get them caught up on their vaccines. You should be able to get your child caught up on vaccines with just 1 or 2 visits. Next slide. These graphs I put in because they help tell an important story. It's an exciting story where we see, starting in January, the proportion of people who are beginning to get vaccinated. And you can see that almost all of those colored lines rose and began to rise relatively quickly, so that we have a nice steep rate of rise over the spring and summer for everybody other than those individuals in the yellow bars. Those are our teens. Those are the kids that we're talking about right now. They are just now starting to get their first doses, and they've got a long way to go to catch up to where we are. And we all have a long way to go to get to 100%. That's where I want to be, where all of us can be safe and comfortable and relaxed, not worrying about this virus in the months to come. Next slide. So one thing that's important to share, I think, is how do we know that this vaccine will work? It's easy to say, well, this vaccine works really well in older people, and we know that. We know it because of the trials that were done in older people, and we know it because we've given now hundreds of millions of doses to adults. But it's important, I think, to share with you the data that were generated that led our FDA and CDC to both say, yep, this is a vaccine that is effective and can provide real protection to our kids. So this simple diagram shows what they found. So in the key study, there were about 2,500 children involved between the ages of 12 and 16. They were split half and half. Half of them got the real vaccine and half of them got a placebo, basically a shot that just contained the saline or salt water. Then these children who didn't know what was in the shot they got were then observed for the next several months. Out of all of those children, there were 18 that developed COVID. When the trial was all done and the code was broken, and the scientists learned who got the vaccine and who didn't, surprise, surprise, 0 children who got the vaccine had COVID. All 18 of the children who had the placebo vaccine, the saltwater shot instead of vaccine, that's where all 18 of the children who got infection were. So this is really one of the most powerful examples of how well this vaccine works in teenagers, and is, to me, as a pediatrician who's watched and participated in many vaccine trials over the course of my career, some of the most impressive data I've ever seen about a new vaccine. Next slide. So we got to talk about side effects. Anytime you take a medicine, you get a vaccine, you got to think about side effects, and it's smart to. So I think we should all expect when we get any vaccine that it's going to hurt. It hurts when it goes in, and your arm can ache for a couple of days afterwards. That's definitely true with this shot. Many people, myself included, had a sore arm for the day afterwards. It didn't keep me from doing anything, and this rarely causes people any sort of limitations in their activities. Sometimes there's a bit of redness where the needle goes in. There can be a bit of bruising. Both of those findings should go away quite quickly, in the order of a couple of days, and then a modest amount of swelling, which, if it's bothersome, can go away either with a cold pack, a little bit of Tylenol. Some kids and adults experience a bit more symptoms. They kind of feel a little different than usual. They feel a little more tired. They may have more of a headache or just general achiness. A few people actually experience fevers. Again, these are symptoms that last a short period of time, typically on the order of 6 to 24 hours, and then they're gone and don't return. And so the question that I like to pose to people I'm talking to is, what do you think about having a day with a sore arm, a day when you're not feeling terrific, in exchange for the confidence that you're not going to have to worry about getting sick yourself? You're not going to have to worry about your child getting sick when you drop them off at daycare, send them off to school, or they go off to their after-school job. And I think, in my personal equation, this is well worth it. Next slide. So, what are some of the good reasons to get your child vaccinated? I think, obviously, as we just talked about, to allow them to stay healthy and get back to and really engage in their usual activities. Quarantine and isolation have not been good for children. They have been incredibly disruptive to children, to their families, to their education. And we know that currently none of our public health requirements require a vaccinated child to go into quarantine or isolation. So right now, getting vaccinated is a great way to stay engaged and involved in your activities, even if you get exposed to the virus. For me, one of the really important things that I share with my friends is, if you get your children vaccinated, you're going to stay healthy and safe, and other people in your family are going to stay healthy and safe. For me, that's especially important. I have an elderly mother that spends a lot of time with my family. I don't want to have to worry about my kids getting her sick and us all feeling horrible that she got ill. And then last is to try and help our community, our schools, and all of those great activities kids participate in to restart and get back to normal, to begin to ease some of those prevention practices. We've just been hearing about how individuals who are vaccinated don't have to wear masks all the time when gathering with each other. What a great opportunity for teens to get back to something more normal, to be able to hang out in the park with some of their buddies, knowing that they're safe and they don't have to mask. I also think that having high levels of vaccination among our school age kids and teens is going to be incredibly important for getting schools open and keeping them open through the school year, for keeping sports teams moving and participating in their seasons, and allowing kids who participate in the arts and music programs to be able to have their ensemble play together, put on their performances in front of a live audience instead of Zoom. And these are all the things that I hope we will realize this upcoming school year as we get our children vaccinated. Next slide. And I guess maybe the biggest punchline is this is going to help everybody's both mental health and happiness. I think we've had such an incredibly hard time because of the disease, because of quarantine, because of isolation, because of the economic stresses, that I am so motivated to do everything I can and to help everyone I can get back to normal. Next slide. So what are some reasons that I think are bad, not appropriate to use as an excuse not to vaccinate your children? So first, there's concerns that people mention, like, what if we have long-term side effects? The good news that we can share with you is that long-term side effects from vaccines haven't happened with this vaccine, not with the Pfizer vaccine. We have lots of data on, as I said, hundreds of millions of adults who've safely gotten this vaccine, and we've observed them for over a year now from those adults who participated in the early child. We now have about 100,000 children across the country, mostly teens, who have also been vaccinated. No signals at all about a long-term side effect. Next. The questions about whether or not the vaccine will alter your DNA. We talked a little bit about this already. That vaccine content, that mRNA from the virus, doesn't go anywhere near your body's DNA. And so there is not a chance that there would be any interaction there. Next. And then finally, this question of why does a child need it? They don't get sick from COVID. And as I said, you know, while we probably each know some children who had illness and were pretty well considering, I can tell you there are hundreds and hundreds of kids that I've cared for at CHOP and heard about throughout our region who've gotten very sick and who have infected other members of their household, and to devastating sometimes results. Next slide. So I thought I'd start us off with a few questions that I commonly get asked, but I hope that you'll start typing your questions into the chat box as we go through these ones. So one of the questions I often get asked is, if my child had COVID already, should I bother to give them the vaccine? And there the answer is a definite yes. And the reason why is that we know if you get the vaccine, you are likely to have even higher concentrations of those protective antibodies in your bloodstream, and even longer and better immune protection for the future. So definitely don't get the vaccine if you or your child has had COVID. Another question is about allergic reactions. Some people have had an allergic reaction to a different vaccine and ask, can I get the COVID vaccine safely? In all likelihood, yes, you can, but this is a great time to pick up the phone and talk to your provider or your child's pediatrician and just talk it through with them. Make sure that your decision for your child is a good one. And I would suspect that almost always you'll hear that the answer is yes, very safe to get the vaccine. Another question that I've gotten is, if I get the vaccine today and have to get tested for work or before my child starts summer camp, are they going to have a positive COVID test? And the answer there is no. You will not have a positive PCR or an antigen test if you get vaccinated. The one area that is interesting to know is you will have a positive blood test for COVID antibodies. And that's actually a great thing. What that means is that your body has made immunity and that the vaccine has worked. So your blood test will be positive, but your nasal test will never be positive after a COVID vaccine. Next slide. And so with that, I wanted to stop and make sure we had plenty of time to answer any questions that the audience had. And I'd welcome any questions or concerns that people have.
Thank you so much, Dr. Coffin. So we can start with a question we got in the Q&A, and then we also received many questions when folks were registering, so we can go through those as well, because I think
Excellent.
there's some good ones. So the question in the Q&A is, how will PDPH be working with the school district to make vaccination accessible for students? And, you know, PDPH has been working with the school district really closely throughout this response. And I actually have a few slides I want to get to talk a little bit about the pediatrics team here in the health department. But the short answer is working closely to connect schools with providers. And some of you might have heard about a program called Philly Teen Vax, which is kind of setting up all sorts of vaccine clinics across the city to make the vaccine really accessible. And we can share that resource with you after this so you can learn a little bit more about that program. So then we'll just go through, we're getting a few more questions. This is great, keep them coming. So this question is about myocarditis and pericarditis after the mRNA COVID vaccine, and what are the concerning factors that cause this?
So thanks for the question. There has been a report of a very small number of people having inflammation of a lining of the heart muscle. Some of these people have had this happen relatively close to getting the vaccine. The real question, though, is this related in any way to the vaccine? What my friends who are cardiologists tell me is that this is myocarditis season, believe it or not. So the spring is always when we see people have this illness, and there's not a signal at this point that it's happening more frequently. It's a subject of a lot of study, but there's not any biological or clinical information that suggests that this is connected to the vaccine.
Thanks. And I'm getting a chat from the interpreters that if we could just slow down a little bit so they have time to do word by word for this part, that would be great.
Happy to.
Okay. The next question is, can you explain more about Miss C that we are seeing after children are infected with COVID?
Happy to. So Miss C, which is spelled MISC, stands for multisystem inflammatory syndrome in children. And that's a mouthful. What this is a complication of COVID infection. A very, very small number of children, somewhere around 4 to 6 weeks after they have their COVID infection, develop this inflammation. It can cause high fever, rashes, rapid breathing, heart racing, abdominal pain, and children can actually become quite sick, require hospitalization, and sometimes even ICU care. A couple of really good things to know about this is, one, it is 100% preventable by the vaccine. We have not seen any cases of Miss C after vaccination. The other thing to know is that this is now treatable. We've discovered a very effective treatment that in all the cases I've cared for has worked very well to eliminate the symptoms. And then the last thing, and maybe most important thing, is this is incredibly rare, very, very rare. I don't know the exact numbers, but it's approximately 1 in 10,000 or more. So not at all common.
Great, thank you. So we'll jump into some questions that were asked when folks were registering. There were some questions about is the vaccine safe for children with disabilities, and if there were any children with disabilities in the vaccine trials. I don't know if you know that off the top of your head.
I actually don't know that. I can ask some more about that. I'd be interested to know if there are specific concerns that this individual has, and that would help me look for more accurate information to respond to this question.
Great, thank you. And then we have a question here. Some have said that the COVID vaccine delivers spike protein that can cause infertility. Is that true or false?
The COVID vaccine does have a spike let me back up here. The part of the COVID virus that triggers a protective immune response is the spike protein. The protective immune response to spike protein is something your body makes if it gets the vaccine, but it's also something that your body makes if it gets the infection. So either way, you're going to get antibodies to spike protein if you get vaccinated or if you get infected. Some investigators, initially in Israel, found in the laboratory that antibodies to the spike protein of COVID looked a lot like the antibodies that can get triggered to women's placenta tissue. This concern has gotten, I believe, misunderstood as a concern for infertility. What we know is that hundreds of women have ended up being vaccinated during the clinical trials who were pregnant, and just so early in their pregnancy, they didn't know it. And none of those pregnancies resulted in an infertility problem. We're now far enough out that some of those women have delivered their babies and gotten pregnant again. Again, no sign of an infertility problem. So I think the concern between getting vaccinated and having infertility is not a real concern. And I really hope that people don't use that concern to avoid getting vaccinated, because getting sick from COVID is a very real concern.
Thanks. So we have a few questions about the clinical trials, and I'm wondering if the best way to answer those might be if you have any resources that we could send out afterwards so people can kind of look through the clinical trials and what those looked like. Does that make sense? Yeah.
Sure. Right now, there are fairly dense summary data available in FDA filings, and then some other summaries for lay people. We don't yet have the full scientific, well-organized publications that I can easily share, but I will gather some of the materials I just described.
Great, thank you. And then another question is about the brand. So I think we know that Pfizer is the vaccine right now that's approved for use with those over 12. And then do you have any sense of the timeline for if the other vaccines will also be?
I believe that there are data right now being reviewed at the FDA for the Moderna vaccine for safety and efficacy in children 12 to 18 years of age. And I know that right now there's a big clinical trial going on at 80 different hospitals in the US studying the vaccine, the Moderna vaccine, and I believe also the Pfizer vaccine in children 6 months to 12 years. And so we hope that by wintertime, we will have vaccine, both Pfizer and Moderna, that could be given to children of all ages, 6 months and above.
Great, thanks. So then there's a question about consent and whether children need their parents' consent in order to get the vaccine here in Philadelphia.
Would somebody from PDPH like to take that, or I'd be glad to share what I understand of the health regulations?
Yeah, so I looked into this right before the session, and the regulations in Philadelphia are that anyone over the age of 12 is eligible to receive the Pfizer vaccine without their parents' consent.
That's my understanding as well. But of course, we encourage parents to participate in thorough and complete discussions with their children about this decision, as about all health and prevention activities.
Yeah, that's a great point. And then I see a question here, will more PA universities be mandating the vaccine, and will K through 12 schools follow? And I think that's unfolding as we speak. So universities in Philadelphia and throughout Pennsylvania have been announcing that they'll be mandating it for their students, and some have announced that they'll be mandating it for faculty and staff as well. So that's kind of an ongoing process. And I'm actually glad you asked that question, because we were thinking that our next info session we would love to have be about that topic entirely and have an expert come and kind of speak about what that means. So stay tuned. So I just want to take this opportunity. You can feel free to continue asking questions, but I did just want to talk a little bit about what the pediatrics team here at PDPH has been doing. Someone from the team was planning to present but was unable to make it tonight, so I'm just going to go through her slides on her behalf. So we have a pretty robust team in the Division of COVID-19 Containment that conducts surveillance of COVID-19 cases in schools and child care centers through a database of school contacts. And PDPH does this by sending out a survey daily to contacts in this database, asking facilities to report any COVID cases or presumed cases. So this is just to give you a sense of kind of when your child goes to school, there's a really strong partnership between PDPH and their school to make sure that cases are monitored, and pediatric response specialists will call schools that report cases within 24 hours of the report to provide guidance and do case investigations. So the schools team then uses this information to connect related cases, recommend quarantine periods and school closures, and internally report on overall case and cluster counts by school. So it's a really all hands on deck effort, working with schools using epidemiologists and our clinical team to make sure that we can respond to cases as they arise. And then the pediatrics team also publishes guidance for summer camps, for in-person learning, for schools, child care centers, and preschool facilities. And this team also reviews school health and safety plans and provides guidance on isolation and quarantine and closures. And then finally, I mentioned the Philly Teen Vax program, and the goal of that program is to really make the vaccine accessible to teenagers and create a kind of high energy environment that teenagers will be excited to be a part of, and make getting the vaccine feel a little less intimidating. So I see one more question has come in here Let me just take a moment to read it. So this is a question about the adolescents 12 and up consenting to receive the vaccine. And also, sorry, it's a bit of a long question, so I'm just trying to make sure I get the gist of it. I think I might hold off on answering this since I'm not an expert on this, and I just want to make sure I answer it correctly. It's relating to informed consent that minors can provide. And I will check in with our our counsel and see what he has to say, and make sure to email all of you with the answer to that question. So thank you. So the next thing I just wanted to make sure to talk about, now that you've gotten all this information about the vaccine, I want to make sure you know where you can go to get it. So these are 3 events that are happening on Saturday, where the Pfizer vaccine will be given out. So individuals aged 12 and up can attend these events and get vaccinated. But I would also encourage you to visit our website for a much more comprehensive list of events that are coming up in the upcoming weeks and months. We're constantly scheduling more events and working to make clinics as accessible as possible by putting them in different neighborhoods across the city. So we really want to make sure that now that you've had your questions answered, you know that you can go on Saturday to these places and get the vaccine. And then these are just some resources that you can use. Like I said, the city COVID website has a ton of really great information about how many people in the city are vaccinated, and then a lot of guidance for schools and businesses and individuals. And then I also want to encourage you all to sign up for our monthly newsletter. We'll make sure that this link gets out to you after the session. We include updates on the work that we're doing, and then also updates on the work that other organizations across the city are doing to help contain COVID. And then if you have any general COVID-19 questions, we encourage you to call the COVID-19 call center that's run out of the health department. This call center is available from 8:30 a.m. to 6 p.m. Monday through Friday, and 9 a.m. to 5 o'clock p.m. on Saturday and Sunday. And there are also multilingual individuals who can answer questions in different languages. So this is a really great resource. These specialists are really trained in the most up-to-date guidance, and they can schedule vaccine appointments and answer all sorts of questions about guidelines or isolation and quarantine recommendations. And you can also visit our website, like I said, or email us at covid@phila.gov. So I think that is all we have tonight. We can hang on a little while until to see if anyone has any other questions that you'd like to get answered tonight. Oh, I see a question I'm getting in the chat here. Dr. Coffin, I think you'll be able to answer this. Are there specific places where younger children and teens have to be vaccinated? Do they have to be vaccinated in a pediatrician's office?
So there, the answer is no. To my knowledge, all sites that are currently vaccinating adults, including the commercial pharmacy sites, will be willing to vaccinate individuals 12 and over. I think the events that Emily was referring to, being supported by the Philly Teen Backs, are nice ones to consider taking your teen to, just because they really are designed to be more appealing to someone of that age than the other sites are.
Okay, well, if that's everything, thank you all so much for attending, and thank you, Dr. Coffin, for answering questions and presenting. If anyone has any other questions, please don't hesitate to reach out. We are happy to work with you, and if you would like us to come to your organization and present, we're happy to do that. So thank you all for joining us tonight. Really happy we could make this happen, and please come back next month for the next info session.
Good night, all.